Hello everyone, welcome to General Psychology, Psychology 101, and today we're going to be talking about development in infancy and childhood. So when we talk about developmental psychology, we're focusing on how do people progress, how do people physically, socially, cognitively develop through the lifespan. In developmental psychology, there are three primary questions that we are trying to address. One is whether or not development is continuous. That is it the case where children and adults have the same skills or have the same responses to the environment, but adults are simply better at responding than children are? Or is development discontinuous? Is it the case where children learn completely new skills, new responses, new abilities at different stages of their life? The second question is, do we develop via multiple courses, or do we all across the world, all of humanity, follow the same roadmap of development? So does everyone develop in the exact same way, or do the context, environments, cultures, do they actually modify the way that people develop? And lastly is the controversy between nature and nurture, genes versus environment, which is most important. And we've already talked a little bit about that in terms of, well, the correct answer is both are important and they interact with each other. So development starts at conception. We have many different stages of development within the womb. The brain starts to develop, our nervous system starts to develop. We start to respond to touch or light on the outside of the stomach of the mother. Once babies are born, we see reflexes emerge. Most of these are automatic. They help children basically adjust to their environment. So for example, sucking reflexes help babies get milk. Moro reflexes help babies cling to their mothers so they're protected. We also start to see some of the senses develop in newborns. So touch, taste, smell, hearing. Vision does start to develop, but is extremely limited at this point. So we can then transition into infancy and childhood. So how do we develop within these stages? Well, we see a lot of brain development. We see in infancy specifically the highest levels of neuron development, cerebral cortex development. We see that brain plasticity is at its highest levels at this point. And this kind of early infancy stage is what's known as a sensitive period. Individuals or children, infants who are deprived of stimulation, of interacting with other people, tend to have a loss of function later in life that they can't recover. They need to acquire these social skills, cognitive skills, etc. at these early stages, otherwise they can't learn them at all. We start to see motor skills developing, so we can distinguish between gross motor development, which is kind of large, broad movements such as walking, standing, crawling, etc. And we also see fine motor development. This should be any kind of precise movement that an individual might have. So like picking something up off the table, or pointing at something, grasping, writing, drawing. All of these are fine motor movements. One thing that these motor movements help children do is to explore their environment. And this is one of the prime tenets of cognitive development theory by Jean Piaget. His understanding of how infants and children into adolescence, into adulthood, a little bit how they develop, is that they are motivated to explore their environment. Development is dependent on how they explore their environment. So there are different stages of this cognitive development theory. The sensory motor stage is very basic, first 2 years. Concepts such as object permanence, mental representations, goal-directed behavior start to emerge. In the pre-operational stage, this would be 2 to 7 years, we see some more complex ideas such as socio-dramatic play, such as dual representation. One of the characteristics of the pre-operational stage are the tasks that children can't complete. So for example, they don't understand conservation, they don't understand that things can be reversible, they don't understand other people's perspectives. These are some of the issues that they have. Most of these issues are solved as people transition into the concrete operational stage. This is 7 through 11 years of age. Children start to develop a theory of mind at this point, and their thought becomes more logical, flexible, and organized, and they start to understand other people's perspectives as a result. So Piaget's theory focuses on how children explore their environment and how they learn these cognitive skills via that method. Other theories of cognitive development, specifically Vygotsky's sociocultural theory, focuses on how we interact with other people, and that allows us to develop more cognitively. So his theory of the zone of proximal development and the idea of scaffolding scaffolding rather, focuses on how children interact with others, especially their parents, other peers, wherein the other peers or parents actually help children learn new skills, learn new tasks by helping them perform them, basically doing it for them, and then slowly backing away and allowing the children to gradually perform the task on their own more and more. And that's how they learn to perform these tasks. So how do we develop personality? Well, Erikson's theory of personality development focuses on the different stages in which we have different conflicts that we have to account for. So in the infant and toddler stage, we're worrying about trust and autonomy. In the early childhood stage, we're worrying about initiative. In middle childhood, we're focusing on industry or developing competence or mastery. And these allow us to develop what's known as temperament. These are kind of early appearing stable individual differences in reactivity and self-regulation. So children can be relatively easygoing, they can sometimes be difficult, or they can be kind of in between where they're slow to warm up, where they're cautious entering a new environment, but after a while they end up performing similar to how an easy child would. These different temperaments can lead to different attachments that children have with their parents, especially their mother. We can have secure attachment, which is, for the most part, the ideal type of attachment to have. But we can also have some insecure attachments, such as avoidant attachment, resistant attachment, and disorganized attachment. These types of attachment are determined by many different factors. I said temperament is one. The way children interact with fathers, their mothers, their siblings, and also the different types of parenting styles that are used with children. So we generally see authoritative parenting styles tend to be the most successful approach to child rearing, but there are certain situations in which authoritarian, permissive, or uninvolved parenting styles may be more or less beneficial. Probably not so much permissive and uninvolved, but there are certain situations where authoritarian especially can be ideal. We also see children in this age start to develop an idea of the self. So children start to become self-aware, they are able to recognize themselves, they're able to feel empathy about other people. They start to develop self-control, ways of inhibiting their impulses or drives that they might have that aren't necessarily appropriate. Start to see children be able to delay gratification. And children really start to define, especially into later stages of childhood, start to refine their self-concept. They start to emphasize what they're competent at. They start to make social comparisons to determine who they are. And they start to focus more on self-esteem and the importance that self-esteem can have for pursuing goals and just being happy in general. Lastly, we start to see social development especially occur as children get to the latter stages of infancy and especially into childhood, when children begin to interact with other children a lot more frequently at school. We see that children tend to gravitate more towards people who are similar to them. That could be in more obvious categories such as sex, ethnicity, etc. But as children get older, they tend to gravitate towards individuals who are more have similar personalities to them or have the same interests as them. And as children start to become more and more integrated into a school setting, we start to see that peer interactions become extremely important for an individual's day-to-day happiness. Oftentimes we see children become categorized into maybe ethnicity, gender, maybe interests that they have. But we can see more broad characterizations such as popular children, rejected children, controversial children, and neglected children. And each of these different categories have vastly different outcomes for the children in childhood, but also for the children as they get into adolescence and adulthood. So that's all I have for today. Thank you for your time and attention, and I will see you all next time. Bye-bye.